Important message. If you're over 60 and living in the United States, United Kingdom, Canada, or Australia, your blood vessels could be silently deteriorating, without pain, without warning, and without you realizing it until it's too late. What you eat now plays a critical role. Protecting your heart and arteries is not about medication alone. It's about daily food choices. As we age, especially past the age of 60, our blood vessels naturally begin to stiffen. This process is known as arterial stiffening, and it's one of the earliest markers of cardiovascular disease. In the United States, cardiovascular disease remains the #1 cause of death, with older adults facing the highest risk. What most people don't realize is that every single thing we eat either improves or harms the delicate endothelial lining of our blood vessels. This inner lining controls inflammation, blood pressure, clotting, and cholesterol absorption. Once it's damaged, the door opens for plaque buildup, hypertension, heart attacks, and strokes. A study from the American Heart Association showed that seniors who adopted a vascular-friendly diet saw a measurable improvement in arterial elasticity in just 6 weeks. Think about that. Decades of damage can start reversing in a matter of weeks just from what's on your plate. One of the most powerful foods for your arteries is beets. They're rich in dietary nitrates, which convert into nitric oxide in the body. Nitric oxide is what relaxes and dilates blood vessels, allowing blood to flow freely and reducing blood pressure naturally. In older adults, nitric oxide production drops significantly, which is why beets are critical. Clinical research from the United Kingdom found that just 1 glass of beetroot juice a day lowered systolic blood pressure by up to 10 millimeters per mercury in people over 60. That's a stronger effect than many prescription medications, but without the side effects. People often say they notice their hands and feet aren't as cold, their memory improves, and they feel more energized when they make beets a regular part of their diet. Another vascular protecting food that gets overlooked is salmon, or other fatty fish like sardines and mackerel. These are packed with omega-3 fatty acids, especially EPA and DHA. In Canada and the United States, omega-3 deficiency in older adults is very common due to poor diet or fear of fat. But the right fats are exactly what your blood vessels need. Omega-3s reduce triglycerides, lower blood pressure, prevent blood clotting, and most importantly, they reduce chronic inflammation in the artery walls. When arteries are inflamed, they attract LDL cholesterol like a magnet, which starts the plaque buildup process. Studies from Harvard show that adults who consumed fatty fish at least twice a week had a 35% lower risk of dying from cardiovascular disease. That's not a small difference. That's the kind of life or death statistic people often overlook while chasing quick fixes. And these benefits go beyond the heart. Omega-3s also preserve cognitive function, reduce joint pain, and improve eye health, which are all concerns that become more serious past age 60. But the real issue is that many people in the United States rely heavily on processed foods even after retirement, out of convenience or habit. These foods are loaded with trans fats, seed oils like soybean or corn oil, added sugars, and sodium, all of which silently destroy the arteries over time. You could be eating what feels like a normal diet: canned soup, frozen dinners, deli meats, white bread, margarine, and be driving your arteries into crisis without any symptoms until you're rushed to the emergency room. In Australia and the United Kingdom, public health guidelines emphasize whole foods, but even there, the rise in packaged meals among seniors is noticeable. People are cooking less, chewing less, and getting more calories with fewer nutrients. Your blood vessels, especially after 60, don't bounce back as fast from this kind of damage. That's why reversing it takes intention and knowledge. If you're serious about protecting your blood vessels, then dark leafy greens like spinach, arugula, kale, and Swiss chard need to be on your plate every single day. These are also nitrate-rich, like beets, but they go even further. They provide magnesium, which helps arteries relax, and vitamin K1, which prevents calcium from depositing into the artery walls, a major issue in people with calcified plaque. A US-based study showed that seniors with higher vitamin K intake had a 34% lower chance of developing severe aortic calcification. That's significant. Arterial calcification is one of the most irreversible types of vascular damage, and it's rarely caught early. Eating greens daily is one of the simplest ways to prevent it. And if chewing greens is difficult, blending them into smoothies or sautéing them in olive oil makes it easy. Speaking of olive oil, extra virgin olive oil is another artery-saving food that people over 60 should prioritize. It's rich in polyphenols and monounsaturated fats, which have been proven to reduce inflammation, protect LDL particles from oxidation, and directly support endothelial function. In a long-term study conducted in Spain, seniors who consumed more than 4 tablespoons of extra virgin olive oil daily had a 30% reduction in major cardiovascular events. That includes strokes and heart attacks. In the US, however, many people still fear oils or choose highly refined vegetable oils instead, which are inflammatory and oxidize quickly under heat. Replacing those oils with cold-pressed olive oil is one of the easiest and most powerful changes anyone over 60 can make. Even drizzling it on a salad or cooking vegetables in it can make a measurable difference. Then there are berries, especially blueberries, which are full of anthocyanins. These are antioxidant compounds that strengthen the vascular walls and improve blood flow. Blueberries also reduce oxidative stress, which increases as we age, especially if we're living in polluted cities or dealing with chronic stress. A study from the United States Department of Agriculture showed that older adults who consumed a cup of blueberries daily for 8 weeks had significant improvements in blood pressure and arterial stiffness. Imagine something as simple and delicious as blueberries helping to reverse years of vascular decline. People who added them to their breakfast or even used them as a snack often said they felt mentally sharper and noticed fewer headaches or fatigue during the day. But you also need to understand what to remove, not just what to eat. One of the worst enemies for your arteries after age 60 is sugar, especially hidden sugars found in low-fat yogurts, salad dressings, granola bars, and even healthy cereals. Excess sugar causes your insulin levels to spike, and over time, this damages the endothelial lining of your arteries. It causes chronic inflammation and leads to small, dense LDL particles. These are the most dangerous kind because they slip easily into arterial walls and trigger plaque formation. In the United States and Canada, sugar consumption is still far beyond recommended limits. People over 60 often don't realize that healthy foods are still flooding their system with sugar. Reducing sugar not only protects your arteries, but helps stabilize blood pressure and reduce the risk of diabetes, which is another major vascular threat. Another vascular superfood that deserves serious attention is garlic. For decades, researchers in the United States and the United Kingdom have studied garlic's ability to reduce blood pressure, lower cholesterol, and improve overall blood flow. The active compound in garlic, allicin, only activates when the garlic is crushed or chopped and allowed to sit for a few minutes. This compound has been proven to relax blood vessels, reduce arterial plaque buildup, and support nitric oxide production. In a double-blind, placebo-controlled study published in the Journal of Nutrition, adults over 60 who took aged garlic extract daily for a year saw a significant reversal in plaque accumulation in their arteries compared to the placebo group. This is one of the few natural substances proven to not just slow down plaque, but actively reduce it. People have reported fewer episodes of angina, better circulation to their hands and feet, and improved stamina just from regularly incorporating garlic into their meals or taking aged garlic supplements. Nuts, especially walnuts and almonds, also play a powerful role in maintaining healthy arteries after 60. Walnuts are particularly high in alpha-linolenic acid, ALA, a plant-based omega-3, and antioxidants that protect the endothelial lining. Almonds provide magnesium and vitamin E, which support artery flexibility and prevent oxidative damage. A study from Loma Linda University in California showed that older adults who ate a handful of nuts 5 times per week had significantly better arterial dilation and reduced C-reactive protein, an inflammatory marker directly linked to heart attacks. In the United States, many seniors have avoided nuts due to outdated fears about fat, but now we understand these fats are essential for vascular health. The crunch, the nutrients, the satisfaction, all combine to reduce hunger and improve cholesterol balance, particularly lowering LDL and increasing HDL. Some participants in these studies even said they were able to come off certain medications after consistently including nuts in their diet. But you cannot talk about healthy blood vessels without mentioning fiber. After 60, digestion slows down, insulin resistance increases, and cholesterol tends to go up. Soluble fiber, found in foods like oats, chia seeds, flax seeds, lentils, and beans, binds to cholesterol in the digestive tract and carries it out of the body. This directly reduces LDL levels. The US FDA even allows cholesterol-lowering claims on foods high in soluble fiber because the evidence is so clear. In a large cohort study tracking thousands of older adults across the United Kingdom and Canada, those who consumed 25-30 grams of fiber per day had significantly reduced rates of cardiovascular disease, stroke, and even colon cancer. But the average American adult gets barely half of that. Many people over 60 complain of bloating or constipation, and adding soluble fiber gradually can not only ease those issues, but also support the arteries. Cooked lentils with olive oil and garlic, for example, become a triple weapon against vascular aging. Another food with a surprisingly powerful effect on arteries is pomegranate. This fruit is loaded with polyphenols that directly increase nitric, oxide production, reduce oxidative stress, and even prevent LDL cholesterol from oxidizing, a critical step in arterial plaque formation. In a study from California, participants aged 65 and older who drank pomegranate juice daily for 1 year showed measurable improvement in carotid artery thickness, which is a predictor of stroke risk. That's no small change. And these same participants also showed improved memory, better mood, and lower blood pressure. Many said they felt clearer and more vibrant after adding it to their routine. It's the unique combination of antioxidants, punicolagens, anthocyanins, and tannins that makes pomegranate so effective. Even just a few ounces of juice a day or adding fresh seeds to your salad can make a visible difference. And yet, many people over 60 in the United States are still missing one of the most essential nutrients for vascular health: magnesium. This mineral is required for more than 300 biochemical reactions in the body, including the regulation of blood pressure, insulin sensitivity, and muscle contraction. It also plays a direct role in keeping arteries relaxed and flexible. Magnesium deficiency contributes to arterial stiffness, especially in older adults, and yet it's one of the most underdiagnosed deficiencies in modern health care. Foods rich in magnesium include avocados, pumpkin seeds, spinach, and dark chocolate. In the US especially, processed foods have stripped away magnesium, and many seniors are left with symptoms like muscle cramps, high blood pressure, fatigue, and arrhythmias without knowing the root cause. A simple daily intake of 350 to 400 milliliters of magnesium whether from food or supplementation, can make a major difference. People have shared how they sleep better, feel calmer, and notice less irregular heartbeat just by correcting this deficiency. Speaking of dark chocolate, when it's high in cocoa, above 70%, and free from added sugars or dairy fillers, it can actually improve endothelial function. Cocoa flavanols promote nitric oxide production, lower blood pressure, and reduce LDL oxidation. Multiple clinical trials from the United States and Europe have shown that older adults who consume high flavanol cocoa saw an improvement in arterial function, reduced insulin resistance, and better mood. It's important to choose quality, though. Most chocolate sold in the U.S. grocery stores is too processed to retain these benefits. People over 60 who swap out sugary desserts for a square of dark chocolate often say they feel more satisfied, and their cravings reduce, especially in the evening. Then there are legumes: lentils, black beans, chickpeas, and kidney beans. These are rich in potassium, magnesium, fiber, and plant-based protein. They help regulate sodium levels, support healthy blood pressure, and provide slow-releasing energy, which is essential for blood sugar balance. A Canadian study showed that seniors who replaced animal protein with legumes at least 4 times per week had lower cholesterol and reduced arterial inflammation. It also helped maintain muscle mass, which becomes critical after 60. Many Americans still rely on red meat and processed meats, which are associated with endothelial dysfunction and arterial plaque formation. Replacing even half of your weekly animal protein intake with legumes can offer major protective benefits. People who made this change often shared that their digestion improved, they felt lighter, and their blood pressure readings dropped within weeks. And then we have green tea, long studied in both Japanese and Western populations for its cardiovascular effects. Green tea contains catechins, antioxidants that protect the arterial lining, reduce inflammation, and improve cholesterol ratios. In one US-based study of older adults with high cholesterol, drinking 2 to 3 cups of green tea daily lowered LDL and improved arterial function without any medication. Many seniors who started drinking green tea regularly also reported fewer headaches, more energy, and reduced bloating. It's one of the simplest, safest habits to adopt, and it pairs well with heart-healthy snacks like nuts or fruit. At the same time, hydration often goes ignored, especially among older adults. As we age, our sense of thirst declines, which leads many people to drink far less water than they need. This thickens the blood, reduces circulation, and makes the heart work harder to push blood through the system. Proper hydration, especially with filtered water, herbal teas, and broths, keeps blood viscosity at the optimal level and supports every metabolic process. In hospitals across the United States, one of the most common preventable causes of confusion and fatigue in seniors is dehydration. People are often shocked to realize that simply increasing their water intake clears up dizziness, improves blood pressure, and restores energy. A good rule of thumb is to drink half your body weight in ounces of water daily, unless otherwise directed by your physician.